Until now, care for children was handled separately by each of the relevant sectors, the health sector, the education sector and the social protection sector, without adequate cooperation and coordination between them. The system reforms in Bosnia and Herzegovina, especially the reform of the healthcare system through the introduction of family medicine, led to a transformation of healthcare for mothers and children. These changes especially affected the organization and functioning of the system of primary healthcare and home visiting services, which ceased to be preventive and instead became curative services, focused mainly on the sick and on adult patients. Poor access to healthcare creates additional problems, especially for vulnerable groups such as the poor, the Roma and families with children with disabilities. In 2010, and with the support of UNICEF, the Health Center Tuzla started providing integrated services for improving early childhood development. An especially important component of these services are home visits for families with young children. In addition to home visiting, the integrated services for early childhood development include parent education, early detection for children with developmental delays and difficulties or children at risk, individual or group work with children, medical checkup, referral and coordination with experts and institutions from other relevant sectors, all in line with the individual needs of the child and their family.
Patronažne službe. Htjela sam da vas pitam da li biste vi bili raspoloženi da dođemo u kućnu posjetu, obzirom da nam je želja da pratimo rast i razvoj i vašeg djeteta.
Working with parents during home visits or during activities organized at health centers as part of the integrated services is an important component that aims to improve the parents' knowledge and skills with regards to early childhood development and responsive parenting. Home visits provide an opportunity to assess a child's growth, development, protection and living conditions in the home environment. Their aim is to promote early stimulation, breastfeeding, vaccination, early growth and development, safety at home and child protection. Thus, home visits are the first step towards the early detection of children under the risk of developmental delays or children who have development difficulties and, if necessary, in the provision of appropriate interventions.
Kućna posjeta je bila divna i puno korisna. Dobili smo mnogo informacija o Hamzinim motoričkim drugim funkcijama. Ovo je super, posebno za mlade roditelje koji ne znaju puno o maloj djeci. Korisne informacije smo dobili od sestre. I divna je saradnja i Hamzi će puno koristiti nama posebno ovim prvim danima njegovog života.
The team, which provides early childhood development services at the Tuzla Health Center, is proud of the success achieved in a case of a boy whose developmental delay was detected during a home visit when he was 8 months old, and with whom the Tuzla team worked intensively. Continuous work with the boy's mother and her close involvement contributed to these good results.
Obzirom da on ima teškoće sa motorikom, najbolje će on prevazići taj problem ukoliko bude sa vršnjačkom grupom i ukoliko to bude neke ciljane aktivnosti kroz igru.
In order to make such services available to every child, UNICEF has supported government representatives of the health, education and social protection ministries in development of a legal framework for improving early childhood development. These efforts yielded a policy, the strategy and the action plans for early childhood development, both on the entity and on the state levels. With UNICEF support, the ministries continue to support the mainstreaming of integrated services for early childhood development in other health centers and clinics across Bosnia and Herzegovina.
Rad sa djecom je specifičan. On traži vrijeme. Svakom djetetu morate dati puno vremena da bi taj pregled bio pravi. Mi smo to davno primijetili, ali nismo znali na koji način možemo poboljšati naše usluge. Tako smo došli na ideju da otvorimo Centar za rani rast i razvoj, u kome nam je mnogo pomogao UNICEF i relevantna ministarstva grada Tuzle. Otvorili smo centar i ušli u gotovo sva domaćinstva Tuzle okoline na zadovoljstvo i naše, a posebno onih korisnika centra. Jer to što mi možemo u kućnim posjetama da damo roditeljima i djetetu, to je neprocjenjivo blago i mislim i želja mi je, to je moja misija, da svi gradovi u Bosni i Hercegovini bi trebali da imaju centar kakav imamo mi.
The policy for improving early childhood development will help give all children a healthy start in life through the promotion of health, optimal development, educational and social protection of every child. The establishment of integrated services for early childhood development will strengthen the existing resources in the system and will ensure the fulfillment of the rights of each child according to the Convention on the Rights of the Child.